Welcome, everyone. We're just going to give it about 30 more seconds to let people file in, but thanks for joining us. Great, so we're going to get started. So thanks so much. We are so excited to be here with you all today to discuss the Biden-Harris administration's recent executive order on increasing access to high-quality care and supporting caregivers. In today's briefing, we will discuss how the executive order's actions impact family caregivers and build on the national strategy to support family caregivers. Our panelists today include Jason Resendez, the CEO and president of the National Alliance for Caregiving, Rhonda Richards, Government Affairs Director for the Family and Caregiving team at AARP, Madison Moore, Vice President of Programs and Partnerships at the Elizabeth Dole Foundation, and lastly, Amy from who's Director of Advocacy at PHI. So there's a question and answer session at the end of this, so feel free to drop your questions in the question and answer section of the Zoom. And without further ado, I'm going to pass it over to Jason Resendez from the National Alliance for Caregiving to get us started.
Great. Thank you so much, Tony, and thanks all of you again for joining us for this important dialogue on what this new executive order means for the family caregiving community. Next slide. Next slide. Caregiving is, sorry, go back one. Caregiving is one of those issues that connects all of us. From the moment that we take our first breath to the moment we take our last, caregiving is a constant in our lives. And when I'm in a room, I usually start with a question asking folks to show a raise of hands for those that have been impacted by caregiving. And I'm always shocked but never surprised by the answer to that question, because so many of us are connected to caregiving. And when we look at the data, we see that there are 53 million unpaid family caregivers in this country. That's up 10 million from 2015. This is a large and growing community, a constituency that faces unique challenges when it comes to providing care and the impacts that individuals experience because of that care. And it's this community that deserves action and deserves services and policy supports that are tailored to the different experiences of caregivers across the lifespan. And when we look at the realities that family caregivers face, we at the National Alliance for Caregiving, thanks to our partnership at AARP, around a project called Caregiving in the US, know that there are consequences to family caregiving. Next slide. For example, we see that caregiving is becoming more and more difficult to coordinate. More family caregivers report that it's difficult to coordinate care on behalf of their loved ones. We see that this is in part due to people are providing care for more people than they were in 2015. We also know that people are providing care for individuals living with more multiple chronic conditions than they were in the past. We also know that caregivers themselves are juggling multiple chronic conditions as they navigate care. In fact, over 40% of family caregivers are managing 2 or more chronic conditions themselves as they navigate care for a loved one or chosen family. Next slide. We also know that more caregivers are in high intensity care situations. In fact, 4 in 10 caregivers find themselves in high intense care situations. That means folks that are providing care for individuals north of 8 hours a day, helping with multiple activities of daily living, multiple medical and nursing tasks. So the more hours that you provide, the more activities of daily living that you help with, the more intense the care situation that you find yourself in. And what we see is that this care, this high intensity, care is falling disproportionately on the shoulders of people who are people of color, particularly women of color, people at the lower end of the income spectrum. So this high intensity care is disproportionately impacting folks who really need us to focus on equity and inclusion when it comes to addressing the challenges of caregiving. Next slide. And that's why we're excited. We know that caregiving is becoming more intense, more complex, more inequitable. And so we need an all of society approach to addressing these caregiving challenges. And that's why the National Alliance for Caregiving, along with all of the organizations represented on this webinar, have been championing the national strategy to support family caregivers. The national strategy is our nation's first ever whole of society blueprint for better supporting America's 53 million unpaid family caregivers. It represents outlines 350 federal actions that the federal government can take to better support family caregivers, 150 state and private sector actions to support family caregivers. And these actions span across federal agencies. Over 17 federal agencies have raised their hand to outline actions in support of family caregivers. These actions cut across 5 goals. These 5 goals address many of the challenges that I outlined in previous slides and that you'll hear more about from my colleagues on this webinar. From increasing awareness and outreach to family caregivers, to better integrating family caregivers into care teams, to addressing the financial insecurity that is all too often associated with family caregiving, and putting in place an infrastructure for the development of evidence-based practices for supporting family caregivers. These goals are big, they're robust, they're broad, but these actions help us to turn these goals into achievable wins on behalf of family caregivers across the federal government, across states, and in the private sector. So we're very supportive of the national strategy, and also excited to see that the national strategy is starting to be put into action by the administration. And this is the context for today's webinar, is how the executive order builds on the national strategy to support family caregivers. Next slide. In order to drive the kind of action that we've seen with the executive order and to drive implementation of the national strategy, we at the National Alliance for Caregiving have launched a campaign called the Act on Raise campaign in partnership with leading national organizations that cut across caregiving, disability, aging, and patient advocacy to ensure that we keep visibility up of the national strategy, continue to center the needs and challenges of unpaid family caregivers, and strengthen federal level coordination in support of family caregivers. The Act on Raise campaign is supported by the John A. Hartford Foundation and serves as a platform for driving action at the federal level on behalf of America's unpaid family caregivers. Next slide. When we think about momentum since the release of the national strategy, we're very excited to report on building momentum around implementation of the national strategy to support family caregivers. The executive order centers the contributions of unpaid family caregivers by focusing on some key areas that are outlined in the national strategy and that we see in data are key for unpaid family caregivers. One is by focusing on respite care, enabling folks to get the time that they need to take care of themselves while juggling care for a loved one or chosen family, by focusing on improving the hospital discharge process to integrate family caregivers and provide training and supports, and also improving Medicare education about caregiving and integrating the caregiver into care teams. Next slide. And as we think about specifically the alignment between the national strategy and the executive order, I think there are 2 key areas that I'll focus on. One is outcome 1.2 of the national strategy, which is really focused on caregiver self-identification and knowledge of services that are available. The national strategy makes it a point to drive action towards improving self-identification and knowledge of available services. The executive order builds on this outcome by one, looking at how we clearly evaluate and set expectations for family caregivers in the acute hospital care at home program, which we're seeing a lot of momentum around in terms of shifting hospital care and medical procedures from the hospital-based setting into the home-based setting to reduce risk of things like infections, to decrease burden on the patient, to reduce costs across the system. But we and many others are concerned about, well, what are the effects of this shift from a hospital-based setting to hospital at home have on the unpaid family caregiver? When we know that training is very limited for unpaid family caregivers across the board, does this create additional hardship on the unpaid family caregiver as we see this program expanded and built upon? And so we're excited to see attention paid in the executive order around better setting expectations for family caregivers in the hospital at home program. We're also seeing additional interest in better evaluating hospital at home from a caregiver perspective. And this executive order puts a point on the need to expand that kind of thinking and centering the experience of the caregiver as part of this important program that could potentially benefit both patients, the health system, but also family caregivers if we do a better job listening to those caregivers. We also see as part of the executive order a focus on increasing promotion of the option for Medicare beneficiaries to choose to give family caregivers access to Medicare information. So a focus on empowering family caregivers with information through the Medicare program to make better decisions in partnership with their care partners. We think that's really critical as we think about increasing the support of family caregivers and increasing integration of family caregivers into the health systems and into federal programs like Medicare. This is, I think, a really important start in advancing our ability to better integrate caregivers into care teams and into systems. Next slide. Now, another important area that we are excited about within the executive order that again speaks to the national strategy and also speaks to an issue that we've heard from many family caregivers they want better access to is respite services. We know from caregiving in the US that nearly 4 in 10 caregivers feel that having respite services would be helpful, yet just under 15% have actually used respite services. So there's a big gap between what caregivers would find helpful in terms of better supporting their care and their care journeys and what they've actually been able to utilize. And so expanding access, awareness, and integration of respite into existing programs is really critical for better supporting unpaid family caregivers. Next slide. And we see that the national strategy recognizes this importance in terms of outcome 3.2. Family caregivers can obtain respite services that meet their unique needs. It's a directive outlined in the national strategy. We see that the executive order outlines that as part of a new CMMI, Center for Medicare and Medicaid Innovation model around dementia care, that of the services that are included and tested and evaluated in that model, that respite is included. So another signal that respite care and caregiving services like respite that help folks juggle and better and make care more sustainable are being integrated into new models for addressing and supporting challenges like dementia and dementia care. So this is a step in the right direction. There's much more that can be done to expand access to respite care and the effectiveness of respite care, but this is a step in the right direction aligned with the national strategy. Next slide. So as we think about building on this momentum, we think, again, these are positive steps in the right direction. We're also seeing additional resources being allocated. I think that one of the big comments that we've gotten from folks is, well, what new resources are associated with the executive order and with the strategy? And as part of an effort to build and on the strategy and drive implementation of the strategy, we are seeing additional resources implemented or introduced. In fact, the Administration for Community Living recently announced a $20 million grant program in support of actions outlined in the national strategy. So there is positive momentum in terms of resourcing the strategy. We think it underscores the need for continued coordination, mobilization of family caregivers, of organizations interested in caregiving, touch on caregiving. And so we invite you to join the Act on Raise campaign to be part of building that momentum and drive for action on the national strategy. You can join us by going to actonraise.org. We have 11 amazing steering committee members and over 100 national organizations and state organizations that have joined the campaign since we launched, and then many, many grassroots advocates who have joined as well. So we invite you to learn more by going to the website. You could also snap a picture of this QR code and go directly to the website to join our work in ensuring that this executive order is the first of many steps in better supporting unpaid family caregivers. And with that, I'll turn it over to my colleague, Rhonda from AARP, to talk more about different aspects of how the executive order builds on the national strategy and supports unpaid family caregivers. Over to you, Rhonda.
Well, thank you very much, Jason, and happy to join you today to talk about the national strategy and the executive order, which is an important building step in building on the national strategy. Next slide, please. Okay, one more. Thank you. Okay. So first of all, I'm going to share a few highlights from a poll that AARP released last Friday that underscored that family caregivers are a large and important constituency and why it's important that they were included in this executive order. Many of you know, including from personal experience, that family caregivers are the backbone of a broken long-term care system. Today, about 1 in 5 are voters, and if you consider current, past, and future family caregivers, they make up 78% of voters. Family caregivers spend a lot of time caregiving. They provide about $600 billion annually in unpaid care to their loved ones, saving taxpayers billions of dollars in public programs such as Medicare and Medicaid. In addition, family caregivers spend over $7,200 annually in out-of-pocket caregiving expenses. Family caregivers are evenly split between Democrats and Republicans, and there's strong voter support, over 2/3, and especially among voters 50 plus, 75%, who say it's very important for Congress to help seniors live in their own homes. 57% say the same for supporting unpaid family caregivers. In addition, over 70% of voters across the political spectrum say they would be more likely to support a candidate who backed proposals to support family caregivers, such as a tax credit, paid family leave, more support, and respite services. The slide links to the poll results and the press release. It's important that family caregivers are supported both through administrative and legislative action. The EO is still relatively new, and so I'm turning to a few provisions in the executive order now. As I mentioned, it's still relatively new, so some administrative items may already be underway and some may be newer and not as far along in the process yet. So timing of implementation will vary depending on different factors. Next slide, please. I'm going to touch base a little bit on hospital at home as well as Jason did, but not duplicate. This is a waiver that has been extended. It started during the COVID public health emergency to enable traditional Medicare and non-managed care Medicaid to pay for hospital at home. It's already been paid for by other payers for a longer period of time. But as was mentioned, it's important that we think about the role of family caregivers in this process. And family caregivers are critical to the success of this model because they help supply vital observations, communications, and support for the patient, but there's a general lack of data about family caregivers and hospital at home programs. AARP's Public Policy Institute has done some work looking into this and also shared some family caregiver considerations that hospital at home models can incorporate into policy and program design to support caregivers and patients. Considerations that address ensuring choice, access, and equity, being clear and understandable to the patient and family caregiver, recognizing and supporting the family caregiver, allowing for appropriate levels of research and learning. And more inclusive and supportive policies for caregivers will allow these programs to truly meet the needs of both patients and family caregivers. As Jason mentioned, when Congress extended the waiver for the programs, they also called for a study and report. And the executive order looks at how better to evaluate and set those expectations for family caregivers. So this is an opportunity to make sure that family caregivers are included in that study and report. AARP wrote a letter to CMS last week outlining items and questions for CMS to consider in the study, including capturing the team who is in the home and providing services and what leads to the outcomes, capturing and understanding what happens when there is no family caregiver, and how to collect the data. So this study could also inform future requirements or changes in the model, especially with a trend, as was noted, about more care moving home. And we know already that hospitals are discharging, patients sooner than they used to. And CMS could consider and incorporate family caregiver considerations into the model. So the executive order is about the importance of considering family caregivers in all of this. Next slide, please. Discharge planning is another area that the executive order addresses. CMS issued final discharge planning rules in 2019 that require a hospital to have an effective discharge planning process that includes the patient and his or her caregiver or support persons as active partners in the discharge planning for post-discharge care. However, the rule doesn't specify too much what that actually means. The executive order discusses that the HHS secretary shall take steps to ensure that hospitals are actively involving family caregivers in the discharge planning process, consistent with CMS requirements, including by promoting best practices such as partnerships with community-based organizations and using resources from the Administration for Community Living and the Agency for Healthcare Research and Quality. While the wording of the executive order does not preclude other actions, it is focusing more on best practices and resources. So this could involve things like working with aging and disability resource centers, area agencies on aging, no wrong door systems, centers for independent living, and other community-based organizations who work on discharge planning or care transitions. And using resources from the Administration for Community Living or the Agency for Healthcare Research and Quality, or AARP. And that could include things like toolkits, journal articles, case studies, other resources, the kinds of things that could, for example, be shared in guidance for resources and best practices, such as guidance from CMS. I also want to note that 45 states and territories also have something called the CARE Act to help improve hospital discharge. And this is something that AARP state offices have worked to pass in all of these states and territories over the years. And that basically has three elements, although there's variation from state to state. The three things are requiring a hospital to identify a family caregiver for inpatient admission and reporting that family caregiver in the medical record, requiring a hospital to notify a family caregiver of discharge plans for the person in the hospital, and requiring a hospital to offer training on medical and nursing tasks that they might be asked to perform. AARP has developed resources and learnings from CARE Act implementation. There's a whole supporting family caregivers providing complex care series that has a series of papers and themes and practices and examples for hospitals to improve patient and family engagement. So these resources and guidance can be helpful in terms of implementing practices and whatnot on the ground. But we also think regulatory action to include elements of the CARE Act in the CMS discharge planning rules is important and have advocated for that. It would help ensure a consistent approach across states. And discharge planning has been mentioned as part of a proposed regulation on culturally competent and person-centered requirements to increase access to care and improve quality. So we'll stay tuned for what comes next there. And then next slide. As was mentioned, Medicare and family caregiver communication. And this is really important for family caregivers being included, being care partners, and being part of the communication stream and part of the care team. Family caregivers and Medicare beneficiaries might, in the course of their caregiving role, need to call 1-800-MEDICARE to get information about their loved one's care, to answer questions, to advocate on their loved one's behalf, address payment for services, and more. There's a form actually that Medicare beneficiary can fill out at their option to authorize a family caregiver's access to their personal health information through 1-800-MEDICARE. But many beneficiaries and family caregivers probably don't know about this option and that this form exists. So under the executive order, HHS will increase promotion of this option. The form is available currently in English and Spanish, and it's linked there in the slide. So promoting this option is important, and CMS could make the form more accessible, such as by making the form available in more languages. And if Medicare beneficiaries and family caregivers know about this form, it could help save them time, stress, and make it easier for them to get the information they need and advocate on behalf of their loved one, be an active member of a care team, etc. So as you can see, a number of important pieces here that help build on the national strategy. And thank you very much for the opportunity. And now I'm going to turn it over to Madison Moore with the Elizabeth Dole Foundation. Thank you.
Hi there, good afternoon. My name is Madison Moore. I'm the Vice President of Programs and Partnerships with the Elizabeth Dole Foundation. And I'm going to take some time to speak about the executive order's impact on military and veteran family caregivers. That is who the Elizabeth Dole Foundation exists to serve. And we're very proud to be part of today's webinar and also to be working with NAC and lots of partners here to help implement the RAISE strategy and to be working just on behalf of caregivers of all communities. So next slide, please. A little bit about military and veteran caregivers in the context of the caregiving landscape overall. So military and veteran caregivers represent more than 5.5 million family members and friends who care for wounded, ill, and aging veterans and service members across the country. As Rhonda just mentioned, we know that this number and the number of caregivers overall is probably a bit higher, but this is what we know from our research that was conducted about 10 years ago. And we also know that caregivers, specifically military and veteran caregivers, are often helping their care recipients with complex health challenges due to those care recipients' time in their military service. And these complex health challenges often manifest themselves in emotional and behavioral challenges, as well as physical challenges, especially among the cohort of caregivers who are caring for someone that served after September 11th, 2001. Military and veteran caregivers are somewhat unique in that they sort of fall between civilian family caregivers and the programs of support that exist for their care recipients or veterans. So there are programs of support, within the VA or the DoD for veterans and service members, and then programs of support for family caregivers at large. But up until the VA started noticing this problem, and organizations like ours and others here on the phone started really noticing the lack of support for military and veteran caregivers. There wasn't that formalized support. And so we're really encouraged by this EO and some other recent changes in legislation and at the administrative level that recognize military and veteran caregivers a bit more formally. Next slide, please. So this executive order, within this executive order, there are 3 primary areas of impact for military and veteran caregivers. The first is improving access to home-based care for veterans, which is where military and veteran caregivers are really performing a lot of their care and helping coordinate care in the home. Expanding support directly for family caregivers of veterans, and then also improving access and affordability of childcare for military families. And I'll dive into each of these just briefly. So next slide. Within the lens of improving access to home-based care for veterans, this executive order directs the launch of a 5-site pilot within VA's existing home-based care program that provides stipends to veterans and their families for in-home care. So this essentially allows families to hire in-home care where and when they need it, and allows them some additional flexibility that they might not already have. And the Elizabeth Dole Foundation is quite proud that the VA has built this program using some lessons learned from our foundation's respite relief program for military and veteran caregivers that we launched during the COVID-19 pandemic and built with input from the VA. And so now this pilot, as Rhonda said, we're a bit unsure about some of the timelines that initiatives coming out of this executive order will take, but we're encouraged and excited to see when exactly this will happen, and looking forward to working with the VA on next steps here. Additionally, the VA will likely be expanding the Veteran-Directed Care Program. This is a popular program with VA that gives veterans and caregivers more choice in their care decisions. And this will hopefully be expanded to all 172 medical centers by the end of fiscal year 24, with an implementation plan expected this year. And then finally, there will be, or is directed to be, an expansion of VA's home-based primary care program. This is another fairly successful program within the VA, whereby primary care teams go into veterans' home, so that veterans don't need to travel to a VA medical center or a clinic for care. They can get their primary care in their home with a fairly full, comprehensive team, and allows for aging and veterans with complex care, really, and their caregivers to receive that care in their home, which cuts down on travel time and other needs that veterans might face when they're going into the clinic or the medical center to get care. So this would allow for 75 new teams to come into this program to serve an additional 5,600 veterans across the US. Next slide. So the executive order also provides more direct support for family caregivers of veterans in the form of expansion of the VA Program of Comprehensive Assistance for Family Caregivers. We abbreviate this to PCAFC. So VA's PCAFC is currently under review by the agency. Disenrollments in the program are right now paused, given some current challenges with expansion to veterans and caregivers of all eras. So those who served after 9/11 were already enrolled or already qualifying for eligibility, I should say. Now that is being expanded to others. And so this executive order really provides additional support from the administration, kind of that top level support from the administration for expanding eligibility to caregivers of all eras, and also to those caring for veterans with varying disability types, which is something that is needed. And then secondly, this executive order provides increased mental health support for caregivers enrolled in the PCAFC. We've seen support for a pilot program for telemental health. And then we also hope to see some additional clinical resources and potentially grants for those clinical resources in the future. Next slide. Finally, the executive order directs the Department of Defense to take steps to improve the affordability of childcare on military installations. And this is a fairly critical piece on the service member side, whereas we were just talking about the veteran side, this is the service member side. So for military families who might be caring for an injured or ill service member, or caring for a child at home, having access to affordable childcare really wherever they are stationed is pretty critical. So we're encouraged to see this. Next slide, please. So what's next? A couple of things. One is that there is legislation supporting military caregivers and actually touching on some of the provisions we just discussed being considered in Congress. There's a bill in the House called the Elizabeth Dole Home and Community-Based Services for Veterans and Caregivers Act, as well as a package in the Senate called the Elizabeth Dole Veterans Programs Improvement Act that touch on a number of these provisions that essentially improve or expand programs within the VA caregiver program, as well as help coordinate care for caregivers of veterans within VA, and increase some of that respite care funding that we'd really like to see. So if you're looking for sort of what to do next, that would be something that would be, I think, helpful for advocacy to support military and veteran caregivers. Secondly, I think we're encouraged and looking to see some of the programmatic expansion and pilot launch that the executive order calls out to support military and veteran caregivers. And then thirdly, on the DoD side, encouraged to see some of the child care affordability initiatives launch in tandem with some of the other child care provisions that were called out in the executive order more broadly. That's all I have. Really appreciate the time today. And I'd like to turn it over to my colleague, Amy Robbins.
Hi, thanks so much, Madison. I just really want to thank NAC for hosting this webinar. It's really an historic moment for care in our country, and to have a president who has brought this up to his level and really elevated the issues of care in our country is pretty amazing. And just hearing the other presenters on this call, I see that we have a lot of synergy and a lot to work on together. So I appreciate the opportunity to be here today. I'm Amy Robbins. I am with PHI for more than 3 decades. We have been the nation's leading expert on the direct care workforce. This is the paid workforce that is the front line of our long-term care system. We do our work through research and evaluation, policy advocacy, direct work with employers. Our focus is on improving care by improving job quality. I thought it would be helpful to start with a brief background on the workforce. So next slide, please. The president uses the term long-term care workforce or long-term care professionals in the executive order, and direct care workers are certainly a significant portion of who he is talking about. And so this just provides you a little bit of a snapshot. We have 4.7 million workers who are supporting older adults and people with disabilities across a range of care settings, from private homes to residential care settings to institutional care like nursing homes. They are predominantly female, predominantly people of color, and have a high percentage of representation from immigrant communities. Next slide, please. This is the projected number of new jobs. And this, when Jason was talking and talked about the number, the really significant increase in family caregivers, this is being mirrored in the paid caregiving workforce, right? We're looking at adding 1.2 million new direct care jobs to our economy by 2030. It's a higher growth sector than any other sector in our country. It's being driven, as I'm sure the family caregiver numbers are being driven by our aging population and by people living longer with chronic diseases and conditions that call for an additional level of support. Next slide, please. We have, coupled with that, in the direct care workforce, we have a real issue of quality of jobs. And that's really what is driving the number here. So by 2030, we're looking at having about 7.9 million total job openings. So that's the combination of the new jobs that was on the previous slide, and the number of jobs where we'll be needing to replace workers who have left. And workers are, leave for a variety of reasons, but we do see them leaving for other occupations. This is an older workforce. We anticipate there will be retirements and folks leaving for other reasons. And so it creates a churn in the occupations that is going to result in this really staggering figure of needing to place 7.9 million people into direct jobs in order to meet the care needs that we are going to experience going forward in our country. Next slide, please. So one of the key drivers of job quality is certainly what people get paid, right? So this slide just depicts over the past years, past decade, how direct care wages have evolved. So the top line here, it's green, is the nursing assistants. So these are the workers in nursing homes primarily. And their wages are right around, they're the highest paid direct care segment of the workforce at $14.41. That blue line there is the home care workers. They are the largest segment of this workforce. They are the fastest growing segment of this workforce, and they are the lowest paid segment of this workforce at $14.09. So that's certainly a large factor around job quality and contributes to that churn issue I was just talking about. Next slide, please. But there's many aspects of impacting job quality. So, you know, a low wage results in a low median annual earnings. So we're looking at about $21,700 a year. That means that about 40% of this workforce live in or near poverty. 43% rely on some form of public assistance in order to make ends meet. This workforce really suffers from disproportionate rates of occupational injury. It's obviously a very physical job, and with limited access to quality healthcare, you know, it's an exacerbating factor. And that workforce instability, the churn, you know, contributes to that high turnover rate that you see here. But that turnover rate then contributes to a high level of vacancy, right? As employers have a very difficult time backfilling those positions as people leave, like at that kind of a rate, being able to backfill those positions. That means that more gets asked of the workers who stay, and they're asked to serve more people. They're asked to provide more care, work for longer hours. And that then really has an impact on the number of people that stay for a long period of time. And so we see people not just leaving the direct care workforce, but leaving it within a relatively short period of time before you know, even a year is up. So next slide, please. So you know, we really see this executive order as really providing the potential for some significant impact on some of the key challenges around job quality that impact the direct care workforce. So I want to, there's a lot in it, and I think a lot of opportunity to impact change, but I wanted to highlight three key areas. So the first one is compensation, because certainly paying these workers more is really vitally important. The executive order doesn't provide a lot of detail on this. What we would like to see, and what we would really like to work with our federal partners to help achieve, is to develop a national and comprehensive strategy around compensation that really, you know, will help dictate Medicaid rates to be able to ensure that there are competitive wages and benefits for direct care workers. They need to take into consideration full-time scheduling barriers and benefit cliffs, along other factors. I was really encouraged to see that the importance of other benefits aside from wages were also highlighted in the executive order, including access to healthcare, retirement plans, mental health supports. So I'm hopeful that there will be a more robust approach to compensation. Certainly will pay workers more, but also recognize that some of those other aspects of job quality are really important. The second one I wanted to highlight is training. The current training infrastructure for direct care workers is really not an infrastructure. It's very fractured within states and has very little to no consistency across states. So to see that the secretaries of labor, education, and health and human services are being called upon to look at ways to expand training pathways and professional learning opportunities is really exciting. You know, we would really like to see a broad coalition of stakeholders come together to establish a national standard for direct care competencies, and to really see some strong leadership to rationalize the training infrastructure for direct care workers. The last one that I'll mention is data collection that was also highlighted in the executive order. And we really need better data on the stability, compensation, size, credentials of the direct care workforce. So this is a really great step in the right direction to highlight that and recognize that we need that data. We need that data in order to identify the gaps in services and be able to identify policy solutions that are going to address some of the concerns. I think, we would recommend that CMS should update its minimum data set recommendations, and again, look at those key aspects around compensation, size, stability. All of those factors will be tremendously helpful towards the work going forward to improve the quality of these jobs. So the last thing I would say is that this is a great start, and we at PHI are certainly eager to engage with our federal partners around this executive order, and certainly to explore further the connection between the paid care workforce and the family workforce, and how we can work together more closely. I think this is just the beginning. We also recognize that there is a very strong need for a much broader financial investment in this sector, and that's going to take congressional action. The Build Back Better Act that Biden tried to get passed would have supported workers and family caregivers in some pretty unique ways. It didn't pass, but I think that's one thing that may be missing from the executive order that will take congressional action in order to really get the resources in place to fully support implementation. And with that, I will turn it back to Tony. Thank you.
Great. Thank you so much for that overview. So we're going to hop into some question and answer session right now. And I've been taking a look at some of the great questions that have been coming in the question section. So the first question that we're going to start out with is actually a comment that was made that having clear areas of responsibility and accountability is critical to the success of the national strategy. So what's the plan to coordinate the 17 federal agencies or organizations that will be a part of the national strategy?
Great. Well, I'm happy to start with that one. One, I think, is the importance of our campaign, Act on Raise, and ensuring that there is awareness of agencies, of the federal government more broadly, that the advocacy community is paying attention to the national strategy, cares about implementation of the national strategy, cares about the coordination, and appreciates the coordination that has taken place. So I think that level of visibility is going to be really helpful in ensuring that continued coordination. Two is the process itself. The RAISE process continues. In fact, they're currently in the process of establishing a new RAISE Council. So the RAISE Council is made up of representatives from different agencies, sort of federal representatives from different agencies, in addition to family caregivers who sit on the RAISE Council, in addition to experts, in addition to experts through a faculty as part of the RAISE process. So there's this standing committee that advises the secretary and helps to ensure that that interagency coordination continues. And so that process will continue to advance. We want to see that continue. We want to see that process strengthen. We want to see additional resource allocated to support the hard work of coordinating across 17 federal agencies, in addition to outlining actions for states and for the private sector. That takes resource, so we're excited about the campaign also focusing on supporting the process of the RAISE strategy and that federal coordination.
Great. Does anyone else have anything else to add? Or if we don't, I can move on to the next question.
I just want to agree with Jason's comments and also say that having continued visibility and attention and spotlight on the issue and people understanding the important constituency and large constituency that family caregivers make up is important to keeping attention and focus on the issue and making sure that as well as the collective action of Act on Raise and lots of organizations working together to make sure that everything continues and moves forward so that the strategy is turned into action that is real meaningful change and support for family caregivers.
Absolutely. Thank you, Rhonda. So another theme that came up across all of the presentations was respite care. So we had a really great question from Claire. Why do you think caregivers are not using respite services? Is it because they are not aware of the services, or is it because there are limited services that are available within the community?
Anyone want to take a first step? I see Madison coming off mute, which I was hoping she would. So,
yeah, I'd be happy to speak to this from the military and veteran caregiver side, but certainly know that there are differences between caregiving communities. So don't want to issue a blanket statement here, but from what we've seen in actually administrating a respite care program from the Dole Foundation side and also working with the VA is that sometimes the way that respite care programs are designed is really important in how people access respite care. So it's not just that people, the need is there, basically. Caregivers want respite. There is a need for respite. There's a need to take that break, but sometimes it's hard to get it. It's hard to go through the sometimes arduous process of getting respite. It's not always available when you need it, when you want it. It's hard to schedule that, or even hard to know when you might need it. When you might need to, for example, have that doctor's appointment, that specialist that you need to get in to see when your, care recipient might need to be covered by respite care. And so it's important for these agencies when they're thinking about creating a respite care program or pilot to think about structuring it in such a way that makes it easy to access for caregivers who have so many other demands on their life.
I would just add.
Go ahead, Amy.
Well, I would just add from a paid caregiver perspective and looking to the paid caregiving workforce and in providing respite. I think it's a challenging structure, right? Where you have a need for respite that's relatively short term, that is could be immediate, right? Or it could be for a period of a week. It's challenging to have a paid workforce structure a job right around that kind of approach, and often you're coming into a care environment where you may not be familiar with the person, you don't have an opportunity to develop a relationship with them. It's very challenging. It's a very challenging care environment from the paid caregiver perspective. So I just it could be in part that people are not accessing it because it's very hard to find people who can care in that kind of a structure.
Absolutely. So with that, we'll move on to our next question. So we had a great question from Shayna. How can family caregivers get involved in advocating and collaborating? And I know all of the organizations on here have different avenues to do so.
Yeah.
No one wants to speak over each other, but if you all want to give a little bit on that would be great.
And this is Rhonda. I'm from AARP. I'm happy to share links for this too. Folks can join and become an e-activist with AARP. You can get an advocate newsletter and updates and information on what's happening in Congress and opportunities to take action on areas of issues of interest to you. We also have a family caregiving Facebook group that folks can join, family caregivers can join and share their experiences with one another, and get tips and information and find that sense of community with fellow family caregivers. So I'm happy to share both of those links for the family caregiving Facebook group, but then also to be an activist and get involved that way as well.
And I'll just build on that folks can join the Act on Raise campaign at actonraise.org. You'll get information about how to advocate on behalf of the strategy, but also to share your story. So if you're an individual caregiver, you'll see that we have a caregiver map that is organizing caregiver experiences by state, by different conditions, whether you've been caring for someone living with Alzheimer's or with cancer or a rare disease. We're trying to curate and make those stories available to help drive the change that we need in terms of implementing and building on the national strategy.
I would just say for family caregivers who might have a military service member or veteran in the home, we'd love to have you join our Hidden Heroes caregiver community. That is an online community on Facebook, but then we're also publishing regular policy updates across our social media channels on recent legislation, including the pieces of legislation that I mentioned.
And I would just say, it sounds like there are really fantastic ways that my partner organizations are engaging family caregivers. And I think for our part, we're increasingly interested in the intersection between the paid care workforce and family caregiver workforce. And so we're really looking forward to learning more from all of these initiatives and how they can inform policy on the paid caregiver workforce. So just a plug to get involved and have your voice be heard, and certainly to explore the issues around paid caregivers and how they can support family caregivers in new and different ways.
And I'll just share the links verbally too for the eActivist, www.aarp.org/get involved. And for the Facebook group, facebook.com/groups/AARP family caregivers.
Great. So with that, we'll jump on to our next question. So someone asked, as researchers based in the field, it would be great if we could help develop measures to collect the data that presenters mentioned, as well as help analyze and develop reports. How else, as researchers or field researchers, can we directly help with carrying out all this amazing work that is being proposed?
Wonderful. Well, I love that question, and I think I recognize the person who asked that question. So one is joining the NAC Research Collaborative, and we'll make sure to share information about that. But then also a new opportunity was just released by the Administration for Community Living in support of the national strategy. It outlines 5 funding opportunities. Funding opportunity goal number 5 is related to exactly that question, supporting the development of a national research infrastructure related to family caregiving, developing things like common measure, common standards for data sharing. So for the first time, we see not just a goal outlined, but also resources outlined to help support the development and implementation of that goal. So we're excited to be working with our research collaborative on many of these issues. And so that's one way that you can get involved, but then also being aware of opportunities to insert the caregiver perspective from a policy perspective when it comes to data advocacy agenda, data collection, data integration, I think is another. And I'm sure all of us have ways that you can find out about those opportunities through our respective organizations.
Great. And before I pass it off to Jason to close this out, we do have one more question that I think is really important. How have leaders from Congress responded to the executive order? Is there currently legislation, aside from the bills Madison mentioned, that might increase the scope and impact of the order?
So I can highlight one piece of legislation, which is the Better Care, Better Jobs Act that was introduced by Senator Casey. There were Senate hearings on this in April. And it's really looking at Medicaid is the primary funder of paid direct care services. And it is the bill is really focused on transformational leadership through the Medicaid channels. and requires states to establish a home and community-based services infrastructure improvement plan, recognize the indivisibility between job quality and service delivery. So it's really trying to be extremely innovative and support states in exploring an innovative space around their Medicaid models. So we're hopeful that that will continue to move through the Senate and certainly getting some attention. So I'd throw that one out there.
I'll note some legislation not directly related to the executive order, but there's legislation that's been introduced in prior Congresses that hasn't been reintroduced yet this Congress, but will be called the Credit for Caring Act, which is would establish a federal tax credit for eligible working family caregivers to help offset a portion of the out-of-pocket costs that family caregivers have, which the out-of-pocket costs on average are over $7,200 annually. And the financial strain from that is higher for African-American, Black, and Hispanic Latino family caregivers. I also think that as Congress continues and there's continued attention to this issue, that we'll see additional bipartisan legislation to support family caregivers introduced in Congress.
Absolutely, and I would just add on top of those critical pieces of legislation, also not reintroduced, but some bipartisan conversations happening around paid family and medical leave to help the 61% of family caregivers who provide care while employed make that care more or less economically challenging. So we're excited about that. We're also excited about the Home and Community-Based Services Act, which would make HCBS a mandatory benefit within Medicaid. So I think there's lots of legislation out there that can help build on this important executive order if we continue to do the work of mobilizing and educating members about how important it is to support this growing constituency of unpaid family caregivers.
Great. Well, with that, we're going to wrap up, and I'm so sorry that I didn't get to everyone's questions in the chat, but we're here. So please reach out to us if you have any questions. All of our organizations are happy to respond and would love to engage with you. So with that, I'm going to pass it back to Jason just to close us out.
And just thank you all for joining us. Thank you to our speakers for their time and investment and partnership in the Act on Raise campaign, and to everyone who joined the webinar for everything that you're doing to better support and advance and address the needs of unpaid family caregivers. This is a growing and yet often unseen community that deserves action. So thank you all for working with us to build and to deliver that action.
Thank you.
Thank you.
Bye, everyone.
Thank you. Bye-bye.
Bye.